I'd like to also welcome and acknowledge our board of Sydney Local Health District, who are all here tonight, who have provided the district with great leadership over the course of 2017, as they have since the district was established in 2011. I'd also like to acknowledge members of our wonderful community in Sydney Local Health District, community members who participate in the decisions and actions of the organisation, members of our community that we serve, and very importantly, donors who provide wonderful support for us to purchase equipment and services that we otherwise wouldn't. And we want to give heartfelt thanks to all of you for being here and for the support you give us every day. I'd also like to acknowledge our staff, our district executive, and all of the wonderful staff that we have every day, as Ron said, who come together to make a difference to the community that we serve. It's really wonderful to be here. Our executive know that I look forward to the AGM all year. I hope you do too. We have fun at our AGMs. It's an opportunity to get together to celebrate the year that was and to think about what we're going to do in the year to come. The opportunity to live a healthy life is a universal human right. The reality is global, but it isn't always possible, and it's not always equitable. We are fortunate in New South Wales to have one of the best health systems in the world, and we have the opportunity to promote a positive and healthier future for our communities, all of our communities. And that's and that's why we started Equity Fest this year, which was so wonderful. It was part of our commitment to work together to make a difference where we can, to guarantee equitable access to our health services, and more importantly, good health for all members of our community. Our focus on ensuring a healthy future for everyone will be one of the most important themes of our new district strategic plan for the next 5 years. And for me, it's one of the most important things that I and the executive can do with the board. Tonight we have so many exciting things to talk about, and as you know, I get very excited. And at the heart of my year in review, and that's one of the perks of being the chief executive, are our patients, our people and our culture. Our district is in a good place. We have a very strong and active board who Ron keeps reminding me don't like average. A dedicated staff, a remarkable staff who come to work each day to make a difference in patient care, in our research and in our administration. We have growing partnerships with other agencies, other government agencies, and we've got some of our partners here from education and family and community services and others, our non-government organisations and our community groups to ensure that we together are delivering the best health services possible that meet their changing needs. We have deliberate and robust governance structures and financial management. We have a positive, inclusive, caring culture which continues to grow. We're proud to be leaders in performance, and we are dedicated to our vision for healthy futures. On the 1st of January 2011, it was a very exciting night, I have to say, the night before. On the 1st of January 2011, Sydney Local Health District was established. That's 7 years ago in January. We came together as a local network, then a local health district, and we started to prioritise the things that were important for our communities, for our patients, for their loved ones, for our people, our staff, our teams and their loved ones, our Sydney Local Health District family. Together, we built our district vision for excellence in health and healthcare for all. And at our AGMs ever since, we've shared some of the highlights and some of our goals. And this year is no different. Our people have again been recognised for their performance. Sydney is one of the best performing local health districts in New South Wales. Our performance remains at level 0. We keep reminding everyone, 0 is good. Consistently since the district was formed, and our KPIs continue to improve. Across the district, 160,000 people attended our emergency departments. Over 40,000 operations were performed in our hospitals. We had nearly 170,000 admissions and discharges across our hospitals. And we had a lot of babies born. We've got a baby boom. Just under 7,000 babies were born at RPA in Canterbury. And as Ron said, we had over 550 clinical trials underway at our 5 hospitals, giving our patients access to care that they otherwise wouldn't have, the latest interventions, all within budget. In 2016-17, we spent $1.73 billion providing healthcare. If we say it fast, it doesn't sound like much, but it's a lot. And a total of $1 billion was spent on our staff, our most valuable resource. $33 million on visiting medical officers, $592 million on goods and services. We raised $94 million in patient fees, and $214 million from other revenue. So as you can see, we're a very big business, but the business that we provide is a very special one. It's the care of our community. Despite the challenges and increased pressure on our services, I'm very proud to say that again our district has come in on budget, which we've done every year since 2011. And that's a significant achievement. And it's the result of a commitment to responsible health service delivery by all staff across our district. It's been another big year. I can see lots of tired people within Sydney Local Health District looking forward to a rest. And I'd like to take this opportunity to say a big thank you to all of the people that make up Sydney Local Health District for the amazing efforts that they do every day. Thank you. So where to from here? Sydney is one of the fastest growing local health districts in the state. Over the next 20 years, Sydney Local Health District is expected to see a 40% growth in our community. So we need to stay focused to plan healthy futures for our community. In 2018, we will launch our new strategic plan. We need to ensure that our communities feel connected with our local health district and our services by continuing to improve our participation opportunities and communication platforms. We will continue to grow our culture programs for our staff. The Pitch Innovation Series will be returning in 2018, and I'm very pleased to announce we will also be launching a new pitch. I know we've got pitches everywhere. This pitch is really exciting. It will start in March, and it's our health and arts pitch. We will continue the digital transformation of our hospitals, and we'll be running our first digital roadshows that will be open not only to our staff but members of the community who want to come and see the amazing innovations that are occurring in IT within our hospitals. We're continuing to invest in our imaging services, focusing on neurointervention, stroke, organ donation for transplantation and robotic surgery. We will keep running our innovation and research symposium. First year, it was 1 day. A couple of years later, it was 2 days. Last year, it was 3 days with over 3,000 people attending. This time, it's going to be a week. and it'll start in June. And it'll feature our Sydney Innovation and Research Symposium, The Big Idea, and the Sydney Robotics Summit, and more. We're also going to be transforming our outpatient services so they really meet the needs of our community. As Ron said, we'll be continuing to upgrade our facilities and services, but very importantly, investing in early years to help grow families and healthy children in Sydney Local Health District. It is true that here in our district, our team continues to push the boundaries of what has previously been possible. Sometimes our people do extraordinary things because it's what has to be done. Over this winter, our staff did the most incredible things. Our emergency departments at RPA, Canterbury and Concord cared for over 40,000 people. 40,000 people in June, July and August. 20,000 of them came to RPA, receiving across the district the most incredible care through one of the worst winters that New South Wales and Australia have known. And they did this with care, with consideration, with professionalism, and with a focus on making sure we get the very best outcomes for our patients. And I really want to thank them for all of the work that they've done. Thank you so much. And sometimes our people make the impossible possible through their collaborations and innovations. And as I said, we have so many of our partners here, and it wouldn't be possible to do the things that we do without them. And sometimes we can do these amazing things because at the heart of everything we do are our patients. Making a difference in the lives of someone else drives us all to keep pushing the boundaries of what we know is possible today and to grow healthy futures. Thank you all so much.